Good morning, everybody. My name is Lisa Salberg, and I'm the founder and CEO of the Hypertrophic Cardiomyopathy Association. Today, I am posting this Go Live video to the Hypertrophic Cardiomyopathy Association's official Facebook page for a particular purpose. In another group that we have here on Facebook, we were having a discussion about what it was like to live with hypertrophic cardiomyopathy. And a great number of the participants in that group, we have about 2,800 members over there, they were asking that we share with the global community on this open Facebook page, the other group is a closed group, what it really is to live with HCM, because we feel that many of our friends and families simply don't understand us. In fact, we think that some of our physicians don't really understand us. So the purpose of this video is to share a couple of things that we want you, our friends, families, and caregivers, to know about living with HCM. So, without further ado, number one, we didn't do anything wrong. We didn't eat wrong. We didn't fail to exercise. Hypertrophic cardiomyopathy is a genetic disorder. And because it is a genetic disorder, we not only live with the disease ourselves, but we live with the fear and the risk of having other people in our family also affected. So if you have a family member with HCM and they've encouraged you to get a cardiac screening to check your heart to see if you have HCM, it's because we're concerned about you and we want you to get the best care possible. We're not trying to pass on our condition to somebody else to make you miserable. We're trying to do something to save your life and to improve your quality of life if you're one of our family members. Some other things that people who are our friends and families try to encourage us with is telling us things like, you should just exercise more, or if you ate a different diet, you'd be okay. This isn't true. Hypertrophic cardiomyopathy is a genetic disorder of the heart muscle. There's something within the heart muscle called the cardiac sarcomere. It's what helps your heart contract and relax. Ours doesn't work right. No matter what we eat, no matter how much we exercise, it's not going to get normal. So we appreciate your encouragement, but understand that when you're telling us to do something that's not going to change things, it's a little frustrating for us. So we love you and we appreciate your input, but you also have to understand what our reality is. We can't fix this problem. There is no cure for HCM. There's another group of us that has gone on to have what's called a myectomy, or an open heart procedure to remove obstruction. Now, many of you think that this is a fix. If you get the operation, you don't have HCM anymore. That's not true either. If we have surgery, that gets rid of part of the problem. It gets rid of the obstruction, so the blood can leave the heart easier, but the muscle itself is still thick and stiff and doesn't work properly. So thanks for being there while we're having our surgeries, but our surgeries are not cures. They do make us feel a lot better, but they're not a cure. Other things you need to know. Some of us have implantable defibrillators. Defibrillators don't make us feel better. They're there to protect us from sudden cardiac arrest, so that if we were to have a cardiac arrest, the computer implanted in our chest or in our side will shock us back into rhythm. So we're protected. It doesn't do anything for symptoms, though. It just doesn't. So don't think that we're just okay because now we have a defibrillator. So that's another problem. What else do you need to know? We need a little bit more rest than other people. So if we say, no, I'm sorry, I can't go to that event with you, or I'm sorry, I'm too tired, I have to stay in, please don't take it personally. We just have harder days. And sometimes we don't know why we have harder days. It's even something that has stumped the medical community. We call it good day, bad day syndrome. Some days we're perfect, wonderful, can do everything, we don't even feel like we have a heart problem. And other days, we can't do anything. We can't get off the couch without feeling like we're going to fall over. So this is normal for us. This is part of our disease process. What else can we tell you? There's some of us that have to travel very far distances to see a cardiologist who actually understands our disease. And that doesn't seem reasonable in today's world, but it's our reality. we have to travel to specialty care. The Hypertrophic Cardiomyopathy Association has helped to build 30 programs around the country that specialize in the treatment and management of HCM. And some of us have to travel long distances at great expense to ourselves to get to these doctors who really understand us. With all due respect to the cardiology community, there's a lot of great cardiologists out there. We love y'all, but you don't understand us very well, and that's a problem. So we travel to specialty care. What else can we tell you? Sometimes we need to use handicap parking. And if I got out of my car with my handicap parking permit and walked away, you would look at me and think there is nothing wrong with that woman. She's scamming the system. Well, ladies and gentlemen, do not judge books by covers, because this patient with hypertrophic cardiomyopathy is currently waiting for a heart transplant. So you don't know what's going on the inside by what's going on the outside. So if you're a family member, friend, or you see somebody using a handicap spot and you wonder if they look okay, not every problem is visible to the naked eye. So show a little respect. And we don't like using those spots, trust me. It makes us feel disabled and old. And sometimes we don't appear either of those things. So, what else can I tell you? Eating a large meal is hard for many of us, so we eat lighter. If we have a big meal, it's really hard for us to go do something afterwards. So if you want to go out with your friend with HCM and you feel like going out for a big meal and then going out for a walk, they're probably not going to be able to do that very easily. What else can I tell you? I'm trying to remember all of the points that the Facebook group brought up, and they're really wonderful points. I guess at the end of the day, what they really want you, their family and loved ones and employers and physicians to know is that living with HCM is difficult. Oh, I remember. This all started with a post of somebody saying, when somebody asks me how I'm doing, I just say fine, because if I tell them the truth, it upsets them. Well, there are two sides of this. If somebody asks me how I am on any given day, I'm more likely to say, oh, I'm fine, thank you. I'm lying through my teeth. We're really good at lying about how we feel to others because we sound like we're whining and complaining if we tell you what we really feel every day. So we're stuck. And I'm in the mindset these days of really trying to be honest. I have very difficult days right now. But 75% of people with HCM will have obstruction. About 10% of people with HCM won't have any symptoms at all. Some of us have symptoms that are good day, bad day symptoms. So at the end of the day, what really matters is if the person's having a bad day, are you making them feel comfortable to share that with you? If you don't want to know, don't ask. If you do want to know, ask. But be prepared to hear something you don't want to hear. If somebody says, no, I'm not really having a bad day, I've got a lot of chest pain today, or I'm very dizzy today, or I'm just exhausted today, don't try to give them a fix that you don't really understand. Telling them to get out and see their friends more, or eat better, or exercise more isn't the answer for people with hypertrophic cardiomyopathy. The answer for us is get the rest, stay well hydrated if you're not in congestive heart failure, see your doctor, get your medical management balanced, and do your best to have a positive day every day that you can. And when you can't, listen to your body and rest. So the purpose of this video is for our community to share with their friends and families. We don't want people to be sick, but hypertrophic cardiomyopathy makes us feel ill on many days. So remember, it's not what we ate. It's not that we didn't exercise enough. It's not that we should exercise more. It's not that we got too much sleep or too little sleep. It's that our hearts are built wrong. They function incorrectly. And because of that, we have symptoms. If you are in the 10% of people with HCM without symptoms, God bless you. Congratulations. And we hope it stays that way. But for most people with HCM, you will have symptoms from time to time, from anywhere from minor to severe. Some of our people with HCM are on disability and cannot work on a daily basis. And other people can do just fine with every once in a while having to sit down and take 5 minutes for themselves. We're highly variable. But we're here. And you're our family and you're our support, and we need to be honest with you. So let us be honest and tell you when we're having a bad day. I'm reading some of these notes coming up, and Sarah's just posted, my doctor tells me I need more exercise. Now remember, people with HCM should exercise, and we should be active, but we shouldn't be pushing ourselves too much. So a little exercise is good, a lot is bad. For anybody who is diagnosed with HCM between the ages of 8 and 60, I encourage you to learn more about Live HCM, which is a study on exercise. So we know the best limit for us between too much and too little exercise. So you can go to live.hcm or livehcm.org. Sorry, wrong. livehcm.org and learn more about that study. But ladies and gentlemen, I'm here to tell you that HCM is complicated. And we need our friends and family and our support mechanisms to be there and be our friends during the hard days. Lex, I'm sorry, but right now Live HCM is not accepting under 8 for participation. But stay tuned, because if we don't finish enrollment and your child ages up to 8, then we can include them in. I don't know why that number was used. So I want to thank you all for joining. I'm a little overwhelmed. There's been about 80 people to 100 people on average viewing this live, so I hope a lot more share it and it gets viewed later. I've been doing these Facebook Go Lives in our closed group, which is Hypertrophic Cardiomyopathy, parentheses HCM, HCMA. If you'd like to join that group, please send us a request, and we'll be more than happy to join you into our private group where we can have discussions that are not, open to the general Facebook community. It's in the closed group only. But I encourage you to join over there, and I encourage you to stay involved with this page. As I mentioned earlier, I'm currently waiting for a heart transplant, so I've been trying to find new ways to stay connected to the community, and Go Live has been a fantastic tool for that. You're welcome, Lacey. If you're not a member of the HCMA, I'd encourage you to go to forhcm.org and learn more about us and become an active member. So on that, I will say have a great day. I hope you share this with your friends and family members, and I thank you all. Bye-bye.